Assalamualaikum and very good morning. My name is NURHANA HIDAYAH binti Roslan. Today, I would like to present my case presentation, which is the title is Urinary Tract Infection. Okay. Urinary tract infection is an infection in any part of the urinary system, which is the kidneys, ureters, bladder, and urethra. Most infections involve the lower urinary tract, which is the bladder and the urethra. Women are at greater risk of developing a UTI than are women. Among adults aged 20 to 50 years, UTIs are about 50-fold more common in women. In women at the age of 20 to 50, most UTIs are cystitis, which is inflammation of the bladder, or pyelonephritis, inflammation of the kidney. In men, at the age of 20 to 50, most UTIs are urethritis, inflammation of the urethra, or prostatitis, inflammation of the prostate gland. The incidence of UTIs increases in patients more than 50 years, but the female-male ratio decreases because of the increasing frequency of prostate enlargement and instrumentation in men. Okay, I proceed about the etiology of the UTIs. The majority causes of UTIs start when pathogens, usually bacteria like E. coli, reach the urethra and then travel up the urethra to the bladder. Urine is usually sterile until it reaches the distal urethra. Women have short urethras compared to men, and because of shorter urethra is the major reasons why women have more UTIs than men. So basically, most of the cases of UTIs happen to the woman because the woman having the short uretras. The bacteria that most often cause cystitis and pyelonephritis are entry, usually gram-negative aerobic bacteria. First, which is E. coli. Second, Klebsiella. Third, Proteus mirabilis. Fourth, Pseudomonas aeruginosa. Gram-positive bacteria also can be detected in the urine, can be the etiology of the UTI, but it is less often, such as Staphylococcus saprophyticus, Enterococcus fecalis, group D streptococci, lastly Streptococcus agalactiae, group B streptococci. UTI usually happen because of the infection from the bacteria. Types of urinary tract infection. There are two types of urinary tract infection, which is simple or uncomplicated. Another one is complicated. Uncomplicated usually happen to the female. First presentation, no sign of pyelonephritis and not pregnant. For complicated, usually happen to the pregnant woman, male, children, recurrent, pyelonephritis, or elderly. Sign and symptom for the urinary tract infection. For the part of kidneys, usually the sign and symptom, upper back and side or flank pain, high fever, shaking and chills, nausea and vomiting. The part of bladder, with the signs and symptoms such as pelvic pressure, lower abdomen discomfort, frequent painful urination, excessive urination at night, blood in urine. For the part of urethra, the sign and system, burning with urination and discharge. Okay. My aim for this case presentation is to increase awareness of the urinary tract infection with good clinical manifestations. Second, to develop an effective urinary tract infection prevention. Third, to widen our knowledge and to have a strong background about urinary tract infection. Mostly because we don't know about the urinary tract infection, so that's why we can easily get the urinary tract infection, usually among women. This is my case study. Introduction of the patient. Her name is Miss N, 26 years old, female, work as a teacher. She came to the emergency department on 29 May 2019. She complains of having increased frequency of urination, painful urination and lower abdominal pain for the past 3 days. She had no history of fever. She looked well, not in pain, not pale. She denied nausea and vomiting. For the examination, for the vital sign, it showed her blood pressure 110 below 80, which is normal. Her pulse 72 per minute, also normal. Body temperature 37.2 degrees Celsius, which is normal. She is not having fever. Her weight is 53 kilogram. From the general physical examination, Miss N looked normal apart from tenderness in the lower abdomen in the pubic area. The chest examination also looked clear and she had no difficulty with breathing. The early impression from the doctor is the urinary tract infection. Then proceed to the laboratory investigation. Miss N, the doctor ordered for Miss N to do the distinct urinalysis, microscopic urinalysis, and urine culture. From the distinct urinalysis, we can see that specific gravity, the result is 1.040, which is high than normal range. Her pH also high than normal. There are also presence of leukocytes and nitrite. From this, we can see that there are presence of white blood cell in the urine and also presence of nitrite in the urine. If there is presence of leukocyte, this patient might be having infection. When the nitrite is positive, it can be confirmed that there are bacteria in the urine. Second, microscopic urinalysis. We can, when observed under the microscope, we can see that there are presence of white blood cell, leukocyturia, and presence of bacteriuria in Miss N urine sample. But there is no presence of red blood cell. For the urine culture, the Miss M positive of gram-negative rods when observed under the microscope when doing the gram staining. The final report of the urine culture confirmed that Miss N having the E. coli infection. So the final diagnosis for Miss N, she is having uncomplicated urinary tract infection. Because from the sign and symptom, we can see that this patient not having fever. She only have frequent and painful urination, and also she is not pregnant. Okay, the treatment. The usual treatment for uncomplicated UTIs is antibiotics. Antibiotics should be taken for 5 days. First, trimethoprim, 200 mg twice daily. Nitrofurantoin, 50 mg 3 times daily. These two antibiotics can cure the urinary tract infection. A high fluid intake are encouraged to the Miss N during treatment. A high fluid intake is important to remove any to avoid any organism from the bladder. My advice to the patient, the patient must take fluid intake at least 2 liters a day. Regular voiding, regular complete emptying of bladder. Good personal hygiene, such as for females, they should wipe from front to the back after voiding or after urination to prevent contamination the urethra with bacteria from the anal area. This is my advice to avoid patient from having urinary tract infection, usually for a woman, because many women in Malaysia will having urinary tract infection once in their lifetime. So that's all. Thank you.